And we're back to talk with Dr. Rene Buenzow. I know, there's so many important things that are designated out there as specific months or specific awareness that we're trying to raise for issues. And there's an important one you wanted to talk about today.
Yes, there is an important one. Domestic Abuse and Violence Month is October. Currently, the terminology has changed to interpersonal violence, and it's to raise awareness for individuals who may be living in an unsafe environment. When we think about domestic abuse and violence or interpersonal violence, we have the misperception that it's somebody that shows up to the emergency room with a black eye or somebody who has a broken arm, when in reality, interpersonal violence really encompasses many forms. That would be from financial control, controlling your partner so they have limited resources or access to friends, family, job, threatening their partner by taking the children if they separate, yelling, swearing, screaming at your partner behind closed doors, and then in public acting as if nothing is wrong. It doesn't have to always be physical. It can be verbal. It can be financial, as I mentioned. So those of us on the front line, it's really important to maybe be aware of some signs or some cues, if you will, when we're interviewing our patients.
If there are people out there that are struggling, experiencing these things, what are some of the things they can do? Where do they reach out for resources?
Yes, so each county does have access to an advocacy. There's an 800 hotline, and then they will direct you to your local organization that can offer advice. And I want to point out, too, that when individuals experience interpersonal violence, really our role is to support the individual who is experiencing whatever form of coercive control or environment that they're in, to offer them resources and support.
That's Dr. Rene Buenzow, new member of the team, but so great to have you, Rene. Thanks so much for providing the information.
Thank you for having me. I appreciate the time.